What is the epidemic threshold for flu season? Imagine trying to catch a wave at just the right moment. That's similar to how public health officials track flu activity to decide when a flu season truly begins. The epidemic threshold for flu season is a specific point that signals when influenza activity has reached a level considered an outbreak in the community. It helps determine when the flu is spreading widely enough to be classified as an epidemic. One of the main ways this threshold is measured is by looking at the percentage of respiratory tests that come back positive for the flu virus. When at least 10% of these tests are positive over 2 consecutive weeks, it's a strong sign that the flu is actively circulating in the community. This 10% positivity rate is used by health agencies because it indicates sustained virus activity beyond isolated cases. It's like a warning flag that the flu season has officially started. Health authorities also use other indicators to gauge how severe the flu activity is. They look at the percentage of visits to healthcare providers for influenza-like illness, hospitalization rates due to flu, and the number of flu-related deaths. These indicators are compared to historical data to see if the current activity exceeds typical levels. For example, they calculate what's called intensity thresholds, which help classify the severity of the season as low, moderate, high, or very high. These thresholds are based on past seasons and help public health officials decide how serious the outbreak is. Another important measure is the proportion of deaths caused by pneumonia and influenza. If this number exceeds about 6.8%, it suggests the flu is having a significant impact on public health. Combining all these data points gives a comprehensive picture of whether the flu activity has crossed the epidemic threshold. Different health agencies might use slightly different methods or data ranges, but the core idea remains the same. They look for sustained, significant increases in flu activity to declare the start of an epidemic. The 10% positive test rate over 2 weeks is a practical and widely accepted marker for the beginning of flu season, helping health officials and doctors respond promptly. Remember, these thresholds are tools to guide public health actions and clinical decisions. They are not fixed numbers but part of a broader system to monitor and manage influenza outbreaks. If you're concerned about flu activity in your area, it's always best to consult local health authorities or your healthcare provider for personalized advice.